In the basal layer, deep and low, where keratinocytes slowly grow, a subtle change begins its claim. Basal cell carcinoma is its name. Basal cell carcinoma is the commonest type of skin cancer. In the old days it used to be known as a rodent ulcer, and it arises from basal keratinocytes of the epidermis or hair follicles. It is slow growing and locally invasive, and metastasis is extremely rare. Risk factors for basal cell carcinoma are mainly due to the effects of ultraviolet light on the skin. So risk factors include those with fair skin, older males, and basal cell carcinomas affect males 1.5 times more frequently than females. Geographically, the highest incidence of basal cell carcinoma is Australia. Other risk factors include radiation, such as radiotherapy, immunosuppression, and genetic conditions such as Gorlin syndrome. Basal cell carcinoma is a complication of a type of therapy called PUVA, which is a form of ultraviolet treatment for patients with, in particular, psoriasis. Clinically, basal cell carcinoma may occur anywhere, but it usually arises on sun-exposed areas, especially the face, ears and neck, and presents as a pearly papule, often with telangiectasia. It may be a scaly plaque that is superficial, or it can be an ulcerated lesion with rolled edges. At a molecular level, basal cell carcinoma is associated with PITCH1 mutations, SMO mutations, and TP53 mutations, and aberrant activation of hedgehog signaling pathway, also known as SHH, that stands for sonic hedgehog. In brief, the histological features of basal cell carcinoma includes nests or cords of basaloid cells in the epidermis, peripheral nuclear palisading and clefting between the tumor nests, and stroma. And this is the histology of a typical nodular basal cell carcinoma. You can see the nest of basaloid cells with the periphery of cells with nuclei that are palisaded, much like a picket fence. There are a number of different subtypes of basal cell carcinoma, including nodular, that is the most common, superficial, morphiform. This is an aggressive, rather widely infiltrating variant of BCC, pigmented, and a type of basal cell carcinoma known as Fibroepithelioma of Pinkus that was originally thought to be a separate tumour, but is now known to be a variant of BCC. And here is an example of a Fibroepithelioma of Pinkus. Treatment for basal cell carcinoma includes surgical excision and curettage, cautery, cryotherapy, Mohs micrographic surgery, radiotherapy, photodynamic therapy, and topical chemotherapy. Finally, the prognosis of basal cell carcinoma is excellent if it is detected and treated early.